Thank you for joining us this morning. My name is Brian Vu, Policy Unit Chief of the Provider Enrollment Division. The purpose of today's meeting is to inform you about DHCS's Emergency Regulation Package, which will align the DMC provider type with current fee-for-service requirements. This stakeholder session is a follow-up to the prior January 27th stakeholder meeting, as well as a re-recording of June 16th meeting due to clarity issues. We will go over changes to the regulation text since that date, as well as points of emphasis of pertinent statutes and regulations. The targeted implementation date of the regulation package is August 2015. An informational bulletin will be posted to notify providers that the regulations are in effect. In addition, information will also be sent to instruct stakeholders on how to submit public comments during the 45-day period. A notice will be issued by the department and will be sent to stakeholders via snail mail and email, posted on the Office of Regulations website, and published in the California Regulatory Notice Register. Included in the stakeholder notice was a document detailing the sole change to the regulation text since our prior January 27th stakeholder meeting. The only change is the section 51,000.24.4, Substance Use Disorder Medical Director. The previous reference to section 51,000.30 has been removed. Point 30 is an extremely long section that goes over what constitutes a complete application along with the requirements, appropriate application forms for specific provider types, and additional requirements for specific provider types. The department felt that the newly added 51341.1 b 28 was a more pertinent reference point. 51,000.24.4 solely defines the medical director, and section 51341.1 b 28 goes over specific requirements of that medical director. Staff will now go over the points of emphasis for the bodies of law that will eventually govern DMC and currently govern fee-for-service.
W&I Code Section 14043.25. The department shall collect an application fee for enrollment. Currently, the application fee is $553. Every year, the application fee is subject to change. The most updated fee amount will be listed on our Medi-Cal website. The application fee shall not be collected from providers that are enrolled in Medicare or another state's Medicaid. Please submit proof that the applicant has paid the applicable fee. For more information regarding the application fee, please refer to the bulletin on our Medi-Cal website. W&I Code Section 14043.26. Aligning with our fee-for-service side, once the department receives a DMC application, the department is required to take one of the following actions within 180 days. Approve the application, return the application as incomplete, refer the application for further review, deny the application, or withdraw. The exception to the 180-day review timeframe is for a physician or medical director submitting a DHCS 6010. The department is required to take one of the previous actions within 90 days pursuant to 14043.26 g. If the department returns the application as incomplete, the applicant will have 60 days to remediate all deficiencies and submit the complete application package back to the department for review. Once the department receives the application package, the department is required within 60 days to notify the applicant if the application was approved, denied, referred for further review, or withdrawn. W&I Code Section 14043.27. When a provider's application is approved, the provider is granted provisional status for 12 months. Provisional status is a probationary period. At any time during the provisional provider period, the department may conduct additional inspections or reviews, and if grounds for deactivation are found, then provisional status terminates and provider is deactivated. W&I Code Section 14043.28. This section gives the department the authority to deactivate and bar providers from reapplying. A provider will be deactivated and barred from reapplying into the Medi-Cal program for 10 years if the applicant is convicted of healthcare-related fraud or abuse. A provider will be deactivated and barred for 3 years if they fail to disclose information or if they are under investigation. Examples of failure to disclose: are failure to disclose past convictions or failure to disclose ownership in the disclosure statement DHCS 6207. W&I Code Section 14043.36 goes hand in hand with the previous section. This section prohibits the department from enrolling any applicant that has been convicted of any felony or misdemeanor involving fraud or abuse in any government program or related to neglect or abuse of a patient, or interfered with any investigation into healthcare-related fraud or abuse that has been found liable for fraud or abuse in any civil proceeding, or abuse in any government program within the previous 10 years, or is under investigation for fraud or abuse by the department or any state, local, or federal government law enforcement agency, or is terminated under Medicare or under the Medicaid program in any other state. W&I Code Section 14043.65. Currently, the appeals are submitted to the Director Designee in the Substance Use Disorder Division. Once the emergency regulations are implemented, the appeals will be submitted to the Office of Administrative Hearings and Appeals, which aligns to the current process for fee-for-service side. This information will be provided on the denial letter that is sent to the provider if the application has been denied.
California Code of Regulations, referred to as CC&R, further clarifies the broad mandate of statute. CC&R Title 22, Section 51,000.30. This section adds additional application requirements for the Substance Use Disorder Clinic, as well as additional application requirements for the Substance Use Disorder Medical Director. In addition, the DHCS 6001 has been revised to reflect a 12/14 revision date. Please read all of the application's directions and answer all questions completely and accurately. A new form has also been included for the enrollment of the Medi-Cal Director, the DHCS 6010. The department will have a future training for this application. These subsections under point 30, which are little c, 3, capital H and I, as well as little d, 22 and 23, further expand on the necessary documentation for a substance use disorder clinic and substance use disorder medical director. Point 30 is lengthy. Please review in its entirety. CC&R Title 22, Section 51,000.50, which clarifies W&I Code 14043.26. As mentioned earlier, this section encompasses the application review process, which outlines a list of all of the required items that make up a complete application package, including the applications and all supporting documentation and signature requirements. Also covered are the timeframes for application review. Once the department receives an application, it has 180 days to take an action. If the application is mailed back as deficient, the applicant has 60 days to remediate those deficiencies and mail back their application. Once the department receives the resubmitted application, it has 60 days to notify the applicant if the application was approved, denied, referred, or withdrawn. Additionally, this section covers the 5 actions that can be taken on an application, including approval, denial, referral, sending back deficient, or the applicant withdrawing their application. All providers have one opportunity to remediate their deficiencies. Point 50 has a lot of information. One main point is that the department is held to timeframe review periods. CC&R Title 22, Section 51,000.51, which clarifies W&I Code 14043.27. Provisional status is granted for up to 12 months. These happen to DMC providers when approved or when a change in service modalities are also approved. Provisional status can be terminated at any time, which includes deactivation of the provider. If the department fails to take an action on an application within a 180-day time frame, the provider will be granted provisional status on day 181. CC&R Title 22, Section 51,000.53, which clarifies W&I Code 14043.28. This contains the department's authority to deactivate a provider number or location and includes the deactivation circumstances. To name a few, no claim for reimbursement within 1 year, or when a person or entity no longer exists, or if a license, certificate, or other approval is revoked, or when an applicant requests to be terminated. All deactivations shall have due process, meaning they can be appealed through due process.
CCR Title 22, Section 51,000.55. This section provides the Department with the authority to periodically identify and notify specific provider types that they need to reapply. Section 51,000.55 holds the Department and providers accountable to meet timelines to respond. DHCS will notify the provider in writing of their responsibility to reapply. The provider will have 35 days to respond to the notification with either their intention to continue enrollment or terminate enrollment in the Medi-Cal program. If the provider seeks continued enrollment, the department will send instructions on submitting their application. Section 51,000.55 requires the provider to submit their application within 70 days from the date they receive the letter with instructions. If the provider fails to meet the requirements of either timeline, pursuant to Section 51,000.55, the provider will be terminated and deactivated from participation in the Medi-Cal program. CCR Title 22, Section 51,000.60. This section outlines established place of business requirements. These requirements have been set in regulation to ensure providers have a place of business that is appropriate and adequate. An established place of business means a provider is open and conducting business at the time of the application, has the administrative and fiscal foundation, has adequate inventory staff to meet anticipated sales and demands. These are only a few of the general established place of business requirements that most businesses already meet. We encourage you to review this section for a better understanding. We would like to note that the department recognizes that the DMC program is unique. Therefore, some requirements have been removed. For example, DMC clinics are exempt from meeting established place of business requirements of signage, identifying the location of a medical healthcare provider. Again, we encourage you to review this section thoroughly for a better understanding, as failure to meet applicable established place of business requirements will result in denial of your application. CCR Title 22, Section 51,000.70. This section requires each substance use disorder clinic to have a professionally licensed medical director who must enroll using the new form DHCS 6010. This section also requires a licensed medical director to not be excluded from participation from state Medicaid or federal Medicare, be enrolled in the Medi-Cal program in their respective profession, and be in compliance with all laws and regulations of the Medi-Cal program. CCR Title 22, Section 51,000.75. Although this section does not require a substance use disorder clinic to have a licensed substance use disorder professional or non-physician medical practitioner, if employed, a clinic is required to list all their licensed substance use disorder professionals and non-physician medical practitioners on the DHCS 6001 and must enroll using the DHCS 6010. This section also requires licensed substance use disorder professionals and substance use disorder non-physician medical practitioners to not be excluded from participation from state Medicaid or federal Medicare and must be enrolled in the Medi-Cal program in their respective profession. CCR Title 22, Section 51451. This section clearly states that all candidates meeting program requirements may participate in the Medi-Cal program except those that are suspended or deactivated.
That concludes our presentation. Today's webinar will be posted online shortly, as well as the slides. All questions can be directed to DHCS DMC research at dhcs.ca.gov. PED has received general questions from the June 16th meeting that has been posted online as a Q&A. In addition, PED recommends the DMC provider community review the draft regulation text, draft forms of the DHCS 6001-6010, as well as the full slides for statutes and regulations. Thank you and have a great day.